Good afternoon. My name is Dr. Rodny Thomas. I am the specialist ENT at Abeer Medical Center, Hamour. Today I'll be talking about sinusitis. So, what is sinusitis? Sinusitis is nothing but an inflammation of the lining of your sinuses. When we talk about sinusitis, we ask what are the causes of sinusitis. So, anything that can cause a swelling of the lining of your sinuses, which can lead to congestion of the sinuses and the accumulation of mucus inside your sinuses can cause sinusitis. Now, the most common causes of sinusitis are changes in the temperature, changes in the air pressure, allergies, excessive use of nasal decongestion, excessive swimming, diving to depths, smoking, a growth inside the nasal cavity, something known as polyps, which can block the sinus passageways. All of these conditions can cause congestion within the nasal cavity, leading to sinusitis. Now, when we talk about the symptoms of sinusitis, what are the symptoms that we generally see in OPD basis? The most common symptom that we see is pain, pressure around the eyes, pain in the forehead, pain and pressure around the cheeks, pain and pressure in your tooth region, headaches. Fever can be a symptom, a decreased sense of smell, a growth that is seen inside the nasal cavity, cough which is more excessive at night, and aches around the tooth. These are the most common symptoms that we encounter in the OPD basis. So when it comes to the treatment of sinusitis, it all depends on the cause of sinusitis. Sinusitis can be divided into acute sinusitis as well as chronic sinusitis. Acute sinusitis is generally managed with over-the-counter medications, something to relieve pain, the pressure that you feel. We would also recommend taking a nasal decongestant spray to open up your nasal cavities, to open up your nasal passageways, saline rinses. We might also prescribe corticosteroid nasal sprays. Once again, that is also to open up the nasal passages along with antihistamines. If we feel that the sinusitis is due to a bacterial or a viral infection, we would prescribe antibiotics, which you would have to take for a period of 7 to 10 days. Now, if your condition is chronic being that you are having this condition for more than 7 to 8 times in a year, then the option would be surgical correction of your sinusitis. The operation is known as FES, functional endoscopic sinus surgery, in which through the nose we go into the sinus passageways and open up the sinus passageways with the prospect of you not having to ever have sinusitis again. The reason why I was talking about sinusitis is because it is something that it is quite common. Many people would face sinusitis. Many people would come with symptoms of sinusitis, not really knowing how to treat it, not really knowing what is the cause of sinusitis. So if at all you are experiencing any of the symptoms as I mentioned above regarding with regards to sinusitis, it would be advisable for you to visit an ENT doctor and take the appropriate treatment for the same. Thank you.